In this video, I'd like to talk about what to expect on the day of your airway surgery. This is specifically for teens and adults. On the day of surgery, you'll report to the surgery center or hospital where your procedure is scheduled. You'll check in, and then you'll be taken to the preoperative area. There you'll change to a surgical gown. Then a nurse will review your health history, ask about your medications and any allergies, and place an IV. That IV is used for fluids and medications before, during, and after surgery. Next, your surgeon will come visit with you. You'll review the plan again, and you'll have a chance to ask any questions. After that, your anesthesia provider will come meet with you. They'll review the anesthesia plan, talk about what to expect as you're falling asleep and waking up, and answer any questions you may have. Then you'll be taken back to the operating room. You'll transfer over to the operating table, get positioned comfortably, and you'll breathe some oxygen through a mask. Medications will then be given through your IV, and you'll fall asleep. Once you're asleep, the anesthesia provider, working closely with your surgeon, and depending on the plan, will typically protect your airway by placing a breathing tube, an endotracheal tube, through the vocal cords. This helps control your breathing safely during the procedure. When the surgery is complete, the anesthesia medications are turned off and you'll wake up. Once the anesthesia team feels you're stable and safe, the breathing tube is removed. You'll then be transported to the recovery area. While you're in recovery, the nursing staff will monitor your vital signs and oxygen level as you continue to wake up. Your surgeon will speak with your family, review what was done and what was found, and go over post-operative instructions. Once you're awake and doing well, you'll be reunited with your family. The nurse will review discharge instructions, answer any remaining questions, and provide written instructions on what to do and what to expect at home. Then you'll be able to go home. From a pain standpoint, airway surgery is usually not too painful. Many times topical medications are used during the procedure to help with irritation afterward. Most patients do well with medications like Tylenol or ibuprofen, and occasionally your surgeon may prescribe something a bit stronger to use only as needed. And that's what to expect on the day of your airway surgery. So now you know. Thanks for watching.